think we're going to get started here. Thank you, everyone. Good evening. Thank you so much for joining us. We're so excited to have you join us for our monthly webinar. Today, the best way to view the webinar is going to be on speaker view. So in the upper right-hand corner, you can select the view button, and there's going to be a speaker option where you can see a nice side-by-side of Dr. Sceville and her PowerPoint. It just gives you the best view, in my opinion, of kind of seeing everything side by side. Like I had mentioned, your camera is off and you're muted for the webinar. That is how that's supposed to be, but feel free to ask questions by raising your hand and I can unmute you, or putting your question in the question and answer section at the bottom of your toolbar. I will go ahead and kind of address those with Dr. Sceville so that we can get your questions answered throughout the webinar. So of course, our topic is today is specifically on mastering those new patient visits and the tips for dental sleep professionals. So again, feel free to ask those questions throughout the webinar using that chat box or raising your hand. We will be giving out a wonderful promo code at the end of the webinar, so make sure you stick around for that. For those of you who are new to joining us, we host these webinars monthly. Like Dr. Sceville mentioned, they cover all things sleep and TMJ as well as practice growth in these areas. So if there's ever a particular topic you'd like us to address, feel free to drop that in the chat box, and we're happy to kind of coordinate a speaker with that and get those topics addressed for you. So a little bit about True Function. I don't know if I do know that there's a few new familiar faces on here. So for those individuals, a little bit about True Function. We specialize strictly in sleep apnea and TMJ appliances. We're actually celebrating our 26th anniversary this year. So we've been doing this for quite some time, and we take great pride in employing some of the most skilled technicians in the industry, ensuring that we deliver the highest quality appliances at every delivery. Should we identify that any concerns come up to impact the quality of delivery, we prioritize transparent communication. And with our 7-day business turnaround, our goal is to support you in treatment for your patients as efficiently as possible. So we're grateful to have you join us today, and we appreciate your commitment to expanding your knowledge, of course, on sleep and TMJ. I'd love to introduce you to our dear friend here, and I know I say that every month, but I truly mean it here at True Function, of course, Dr. Jodi Sceville. So Dr. Sceville is a general dentist practicing in her hometown of Oakdale, California. She specializes and focuses on treating patients with obstructive sleep apnea and TMJ dysfunction. She is a passionate advocate for total body health and wellness, integrating innovative approaches to improve her patients' quality of life. Her journey into fields of dental sleep medicine and craniofacial pain began on a personal level as she faced her own challenges with sleep apnea. Inspired by her experiences and her family's support, Dr. Sceville committed to deepening her expertise in sleep apnea and pain management. Dr. Sceville works with her husband and practice partner, Jeff, who I like to refer to as Mr. Dr. Sceville, who's also a dentist, and collaborates with an extensive network of medical and dental professionals, ENTs, sleep physicians, physical therapists, and more, to provide patients with comprehensive and multidisciplinary paths to health and wellness. Outside of her professional life, Dr. Jodi is a proud mom of 2 college kids and loves lake life activities. She is a diplomat of the American Board of Dental Sleep Medicine and has professional affiliations with the American Academy of Craniofacial Pain, American Academy of Dental Sleep Medicine, and the Spencer Study Club. So thank you so much for joining us this evening. I will pass it over to you to get started on the webinar.
Awesome, Trish. Hi, everyone. Thank you so much for joining us today. I know many of you most likely have had a long work day, so I appreciate your time today. And I'm hoping to give you some actionable tips to help improve your new visits with your dental sleep patients. Let's have some fun with this. I feel the more you know about the flow of your new patient visit, the better your verbal skills are, and the more your team knows about the flow of the new patient visit, the more success you're going to have. And ultimately, all of us want our patients to say yes to treatment, right? So we're not just spinning our wheels. So today, I'm going to share with you skills to improve 4 parts of the new patient visit. First is building rapport. Second, reviewing the findings. Third, presenting the plan. And fourth, handling objections. So I have 3 main goals. First, if you're a brand newbie doing dental sleep medicine, I hope to give you some confidence in those new patient visits. If you're old school and you've been doing this for so many years, maybe you're even limited to dental sleep medicine, I hope that some of these skills can help you improve your case acceptance. And if you're a team member on this call, maybe you'll get some pearls that you can take back to your practice tomorrow and work with the patients that you see every day. So throughout the webinar, I'm going to pause and I'll ask Trish if there's any questions, because I learn a lot by collaborating and answering questions. And I'm not an expert. I don't have all the answers. So I absolutely love discussion. That's very fun for me. So Trish said a little bit about me, but I practice in the Central Valley of California. We are quite rural where we live. And I do practice with my husband, Dr. Jeff Sceville. And we have a large general dental practice, and we have a practice within a practice. So Jeff is the TMJ part of Valley Sleep and TMJ, and I see the sleep patients. And it's been super rewarding for us. We have 2 young adult children. This is a picture of us diving over the New Year's holiday in Curacao, and the reefs were simply amazing. We saw a lot of cool sea life. And of course, as I get older, I hate diving in cold water. So Curacao was definitely a beautiful warm water experience if you get the chance to go there. There's also beautiful beaches. So that's awesome. I have a golden retriever named Gally, who definitely has sleep apnea. I cannot sleep in the same room with him because he snores. So there's 2 things that I cannot practice without. One is a great lab relationship. I've been working with True Function for quite a few years. Having appliances that have drop-in fits make us look good in our practice. It's easier for my team. It improves patient confidence. So I just highly recommend that you work with a great lab. Also, Frank and his team, his lab team, can help walk you through cases, even difficult cases. They see thousands of cases and can help guide you on appliance selection, perhaps, or troubleshooting things. So working with a great lab is super important. And then, of course, your team. Absolutely love my team. This is a group of smart and hardworking people who help us with patients every day. And as you know, or get further along into dental sleep medicine, you'll see it's highly team driven. And so having a great team behind me means everything. I absolutely appreciate you. So let's talk about how the new sleep patient might enter your practice. I love this visual of a funnel because really that's how patients come into the practice. And of course, there's so many steps along the way that you have to complete, but ultimately we want to get the patient into oral appliance therapy. And then of course, long-term follow-up with their annual checks. I want to back up just for a second and talk to those of you who may be just starting out in dental sleep medicine. And my goal for you is to start making appliances. All these skills that I'm going to talk about and communication tips, you can practice while you're making appliances. Oftentimes I'm on a call with a new provider and they're asking questions about what software to use or what the best billing company is, or maybe what the perfect appliance is. And those are all valid and great questions. But you're kind of putting the cart before the horse. So I absolutely encourage you to start treating your family members, perhaps your team or their spouses. Start making appliances, develop a good lab relationship. And I think you'll find the new patient flow figures itself out a lot better than you think, just by starting. So the way a patient may enter the practice, obviously, is MD referrals. It could be other dentists referring or other providers. If you have a general dental practice, it could be your hygiene exams and screenings, internal or external marketing. And then, of course, those patients that are coming from those sources could be in 2 categories. First, diagnosed. We already have a medical diagnosis of their condition, and they're seeking care for treatment options. Another patient may be undiagnosed. That means they have signs and symptoms of this condition, or you've discovered the signs and symptoms, but we don't actually have a medical diagnosis yet. So work with your team in the office that you're in as to how you're going to handle either a patient who's already diagnosed or undiagnosed so that you can get them possibly referred to the right provider. So now that we've talked about how a new patient comes into the office, let's start in on the skills. The first skill is building rapport. 82% of what people feel when they first talk to you is warmth and competence. So let's talk about warmth. Actually, if you are taking care of warmth and competence, you actually can control 82% of your patient's first impression. That's huge. So let's talk about warmth. And let's say you're a doctor and you say, I don't have warmth. Then find some team members in your practice who can exude that warmth and meet the patient with that warmth that creates rapport. Warmth can be a smile, obviously. It can be a genuine compliment. And I love in my own practice when I hear the team say, hey, John, it's so great to put a face to a name. That increases the warmth in your practice. Competence. So are you building rapport with your new patients? I sure hope this is not a visual of the person in your office or even yourself that looks grumpy and like you're bothering them, and then hands in the air. Nobody really knows what you do in the office or what services you provide. That doesn't show very much competence. So most people are very dissatisfied with their medical care experience. They feel there's a lot of wasted time, that no one really knows what's going on. Maybe they're frustrated because they've been bounced back and forth between multiple specialists. That's how people feel about their medical care. So follow along with this story. Let's say you and your family go up for a hike, and it's a mountainous hike, and you come back the next day and your knee is really hurting. And you think, well, give it a little time. Well, a month goes by and your knee is still hurting. And so you decide you probably should make a doctor visit. And you've seen this doctor advertise that he does regenerative therapy on joints. And you think, okay, cool. And you call the office. Well, this lady answers the phone. She's almost seems kind of pissed off that you called. But you go ahead and you make an appointment. She sends you paperwork, and you spend a lot of time filling out this paperwork on the condition and how it started and your actual problem. Well, you show up for the visit and you see this lady at the front desk. She's not very warm. And you ask a little bit about the services the doctor provides, and she's like, I don't know. The doctor went to some weekend course, and yeah, I don't really know what he does. So that doesn't give you very much confidence. The nurse brings you back and she says, so what brings you in? And you're like, oh my goodness, I just filled out all this paperwork. And so you go ahead and you tell her the whole story again. And then, of course, the doctor walks in and says, so what brings you in today? How frustrating is that for patients? So make sure you have these competence systems in place so that you can really make the patient feel more competent in what you're doing. So foundations in your practice. Let's talk about those just a little bit. What's the visibility of these services, dental sleep services within your practice? Do you have anything in the reception area that might talk about sleep apnea? This could be obviously posters, brochures, booklets where the patient can learn more about this sort of stuff. Perhaps you have a TV in your reception area that you can highlight some of these services. Maybe even if you work in a medical dental building, letting the people around you that practice near you know what you do. So just visibility. Also your website. If you're a general dentist, does your website highlight anything at the first page that these are services that you offer? Does the person answering the phone know about your services? Now, I don't expect my admin team up front to always know everything exactly what we do, but make sure the team answering the phone knows about the dental sleep services. And my two goals on a phone call is that number one, the patient feels that they've called the right place. Thanks, John, you've called the right place. And the second thing is they can say, you're going to absolutely love Dr. Sleepgood. We see great results with our patients. So giving patients that call on the phone the knowledge that you are in the right place and we can help you. If you are a general dentist, does your hygienist know about your services? Please make hygienists your champions. Don't overwhelm their appointments. They've already got a lot to accomplish in a fairly short amount of time. But work with your hygienist, obviously, to identify signs and symptoms of sleep apnea, and work with your hygienist to transfer the care to you simply by saying, I was working with John today and he says he has a CPAP. In fact, the CPAP is in his closet. Transferring that information to you. Or I'm concerned because I see some signs and symptoms. And then give your hygienist the tools when their visit is done with the patient, how to route them to the front desk person appropriately, either to schedule a consultation with you or be referred to the appropriate physician for testing. So make your hygienist your champion. And then I think the most important part is to know your own personal why. I know my why is I've seen so many patients' lives changed by addressing their sleep apnea. And then, of course, for myself, being treated and not waking up with a headache, feeling more energized throughout my day. That's my why. I want other people to experience that and continue helping my patients. Share your why with your team. Maybe find your team's why by treating them or their spouses or their family. So there's a bunch of things you can do to increase rapport. I would love to give just a couple other tips here on rapport, things that we've done in our practice that really make a difference. The first thing is that we send paperwork to the patient. Ours is online, but intake paperwork before the appointment is scheduled. And first of all, we can gather a lot more information about why the patient's seeking care, but it's also so that we can appoint them on the schedule in the appropriate place. And I think patients appreciate that efficiency. Make sure you're looking at the paperwork that the patient fills out. You could also film a short video introducing yourself. And by short, I mean not lengthy, not 8 to 10 minutes, just a short video introducing yourself and that you're welcoming the patient to the practice. You could also email the patient an article, something like 10 tips to help improve your sleep starting today. All of those things helps increase rapport before the patient even comes into your office. So I want to lead into the flow of the new patient visit, and then we'll go on to the next thing and maybe answer a few questions if there's any. My clinical team, when they bring the patient back at their new patient visit, will tell them what the flow of the appointment is going to be. They'll say that we're going to review the findings, and that could either be a sleep test or their signs and symptoms. We're going to discover if you're a candidate for treatment. I think a lot of patients are shocked by that. They think if they're in your office, they're automatically a candidate for oral appliance therapy, and they may not be. So we tell them we're going to discover if they're a candidate. Of course, we're going to go over the options for treatment. And then I love this, that you get to choose how to proceed to the patient. And that takes all the pressure of sales. I don't know about you, but I sure don't like to feel like I'm selling the patient something. But by letting them know that they get to choose their treatment option, it really takes the pressure off of us, and we become more of an educator for the patient during that appointment. I'm going to ask Trish if there's any questions or anything I need to pause for.
I don't have any questions at this time. And just a
Awesome.
reminder, you can use that question and answer box at the
Cool.
bottom of your screen or raise your hand.
Well, everybody's having so much fun. We're just going to carry on. All right, so let's go into review of findings. I love this picture of Indiana Jones finding the treasure. It's that aha moment that you'll encounter with patients where they connect the dots as to their condition and why they're really seeking treatment. And we'll keep circling back to this why during the patient's appointment. So we always think that the patient's why could be CPAP intolerance or snoring or excessive daytime sleepiness. And those are absolutely things that they check box on their paperwork. But there's usually a deeper why, a more emotional reason why the patient might move forward with care. So let me share with you just a few examples of a deeper why in my own patients from the last couple weeks. So I have a patient who says he doesn't like his CPAP intolerant, but he's going on an international trip with his extended family to celebrate, I think it was an anniversary. He doesn't want to carry a large CPAP in traveling, and he's also going to be sharing sleeping arrangements, like a housing with his extended family, and he's very nervous about loud snoring. So for him, his why of seeking care is freedom, freedom to travel, freedom to feel confident in his travel arrangements. So that's his bigger why. A patient has just outlived his father by a year. His father died of a heart attack 1 year younger than this person's age. His brother just had a cardiovascular event. And this patient has teenage children. He's very scared to have a heart attack. So his deeper why of seeking care is his health risks, and he's scared. So being treated will mean freedom for him or peace of mind to have better health. And then maybe John is single, and John wants to get a 10 girlfriend on the dating app. He wants to swipe and find that 10, but a CPAP or snoring is definitely not going to get him a 10. So his why is getting that treated so he can swipe for that 10 on the dating app. And then, of course, a personal one for me is when a young mother comes in and she's afraid of falling asleep at the wheel because of how tired she feels and driving her kids. So getting treated and feeling that energy is her why. So we'll always circle back to this why when we're first reviewing the findings with the patient. So understanding your patient's communication style. Many of you are familiar with the DISC profiles, and by no means do I want to put a patient in a box, but it helps if you can discover how a patient likes to communicate. It will improve your communication skills with the patient. So a D style is going to be comfortable when you focus on key points. They want a sense of control in their options, and you don't need a lot of chit-chat time. An I style is going to be very comfortable with chit-chat time because they want to feel a personal connection with the people they're interacting with. C style is going to be detailed. They want detailed answers to their questions, maybe research, information, efficacy. These are the patients that they come in, they may have a folder, they may have graph paper and maybe a mechanical pencil. They like details. For these patients, as soon as I know they like lots of information, I have printed off different things that I can share with them that I wouldn't share with other patients, just in a binder that's easily accessible to me. And I can really get into some more details for them and that they like. And of course, an S style, they like to build rapport and they like their questions answered with sincerity. So when you understand your patient's communication style, it can actually make the visit go more quickly and maybe seamless. All right, review of findings. This is the second part of the new patient visit. I think it's really important to find your flow when you're reviewing the findings with the patient, particularly, say, a sleep study. I personally like to go through highlights of the sleep study. First of all, how many total times they stopped breathing in the night, and maybe the duration of how long their average time that they stop breathing. I think that's really eye-opening to patients. I like to pick highlights with correlating the times they had desaturations with the times that they woke up in the night. They have this aha moment of connecting the dots. So pick those highlights, be consistent with how you present that because it'll be easier for you. I also like to point out maybe lack of REM sleep or certain stages of sleep if that's available on your sleep report. It oftentimes connects the dots for patients why they don't feel rested in the morning. or lack of sleep. I like to read the room on details. That goes back to the disc with the patient. If you have a patient who clearly doesn't want a lot of details, just stop. There's no need to go into super big detail. I think us as doctors might have a lot of knowledge and want to share a lot of knowledge with our patients, but they don't always want all the details. So simply meet the patient where they are as to how much information and how much detail they need about their condition to connect the dots to discover their why. And definitely don't make it about the oral appliance therapy or the piece of plastic. It's so easy for us to like reach on our shelf and grab that piece of plastic and try to show that. I'm sure you can get to that point, but when you're reviewing the findings, really make it about the patient, make it about that connection for them. All right, let's get into the third part of the appointment is presenting the plan. I love to say to my patients, good news, John, you are a candidate for oral appliance therapy. And I think that's a good sign for them when they say, oh, thank goodness I'm a candidate. I feel like the beginning and end of a new patient exam is the absolute most impactful in the patient's decision to move forward. You can have an amazing intake and have that all nailed down, and the process is flowing. But if you drop the ball and drop the baton at the end of the appointment, it's equally as impactful to the patient. So we'll talk here a little bit about some skills for that. I like to give my patients all the options for their treatment. And that's what we should be doing. I usually start out with saying that there's some surgical options for sleep apnea. Obviously, there's surgery involved, and it can cost a lot of money out of pocket. Most patients are familiar now because of heavy advertising with Inspire. So surgeries, a lot of times they don't even realize it's a surgery, but we always talk about that as the first treatment option in the stacking. Second would be CPAP. And a lot of patients will say, well, doctor, that's exactly why I'm here. I can't tolerate my CPAP, but that is a treatment option. So we definitely include that. Of course, there's oral appliance therapy, and the whole goal is to highlight that as a very convenient and quiet option for them. And you've determined they're a candidate, and that's awesome. But I also include an option for doing nothing at all. And of course, the patients say, no, when can we get started? And that's exactly what you want them to feel and say. But be warned, don't overpromise outcomes. So I want to talk about 4 areas not to overpromise outcomes. The first is in sleep metrics. Many patients, AHI, desaturations, their sleep staging all dramatically improves, and that's fantastic. But you will have patients that don't dramatically have changes in their metrics. They may feel better, feel more rested, all those things, but the numbers don't always move quite as great as we want to. You'll have patients, especially with that C-style personality. They've got the Aura Ring, the Fitbit tracker, the Whisper. I mean, they are hooked up, dialed in. They have so much data on themselves, and they'll come back in and say, I'm not any better. So be very careful not to promise about improving their metrics to a great extent. The second is insomnia. Insomnia is an ugly, ugly stepsister in sleep world with sleep apnea. So you may have the patient's obstructive sleep apnea very well managed, but they're still waking up numerous times in the night. And of course, that's an underlying factor that needs additional care like behavioral management, other tools. So don't always promise that the patient will not wake up in the night because there could be comorbid insomnia issues at play. Of course, don't overpromise resolution of snoring. I love it when a patient wears an oral appliance the first night and they're completely silent, and the spouse is running in the office singing your praises because there's no snoring. It's amazing. It's a miracle. But that doesn't always happen. Most snoring is reduced, but not all. There's a lot of factors involved in this. So on the other hand, you never want the spouse running in into your office the next day, throwing the appliance at you and saying this thing doesn't work. So just make sure you're not over-promising with snoring. And of course, a fourth area not to overpromise is daytime sleepiness. There's so many factors involved in daytime sleepiness. There could be hormonal factors, nutritional factors, or sometimes sleep hygiene issues that the patient isn't always being truthful about that really affect their daytime sleepiness. So be careful not to overpromise those outcomes, but support the patients through these things that they're going to navigate during oral appliance therapy.
I do have a question for you.
Okay, this is a good spot.
And do you permit a patient to choose the brand model of their oral appliance, or how much do you guide their choice?
That's a great question. Most of the time, I have, after looking at the patient's anatomy, of course, and there's a lot of factors. I mean, if it's a little old lady, I certainly don't want something that's going to be difficult for her to adjust or adapt to. I'm usually guiding them to one or two options that would be that I feel would be best for them. If you've built rapport along the way, they've gained that trust in your knowledge. And usually I'm picking one that I work with quite a bit that I feel would be comfortable for them. If they have any hesitation, we could go outside of that. Of course, I work with medical insurances, so a lot of them do require PDAC or a certain type of appliance. And so I'm very open with the patient about that. I hope that answers a question.
I definitely think it did. And I just have the one.
Yeah, good. Awesome. Let's see what we got next here. So presenting the plan. After the patient and I have made these discoveries, we've figured out their whys, we've talked about they're a candidate and some pros and cons of oral appliance therapy. I like to turn to the patient and ask a question, and any of these questions would be appropriate. If you could see an improvement in your snoring, your health risk, or your fatigue, would you proceed? I'm simply asking them a question if they want to proceed. Or on a scale of 1 to 10, we've talked about a lot of things during your visit today. One being, I've just dropped the ball, I didn't do a good job. 10, you are ready to move forward. How do you feel about that today? Or simply, is there any way we could get started right away? I like asking the patient a question because that opens you up for their questions. And what do you think the question the patient is going to ask next? That's right. How much does it cost? So a lot of times when a patient is asking about how much does it cost, they're not always asking about the total cost. They're more asking it how it could fit into their budget. And so I have a picture here of handing off a baton. I think it's really important when a patient asks how much does it cost, as a doctor, you definitely don't want to choke up at this point or look at the door, the exit sign, and run out and leave your team to necessarily pick up the pieces. So when a patient asks how much it costs, I like to have a go-to phrase. And in my practice, it would be something like this. Well, good news is I have an excellent team of people up front who know all about your, maybe if you deal with insurance, they know all about your plan, and they can help navigate the total cost and then how to fit it into your budget. Does it sound like you'd like to discuss that? And if they say yes, absolutely. And that's when I pass the baton very intentionally to my front desk. And I say, listen, Kim, John here, he's really wanting to get a 10 on that dating app. So we circle back to the patient's why. He wants a 10 on that dating app, and using a CPAP just isn't going to work for him. We've determined he's a candidate, and he'd like to know the total cost and how we could fit it into the budget. So make sure you practice this handoff with your team, role play it with your team, because this is a really important part, even if you don't deal with medical insurance, how we can present the plan and get the patient to say yes. And then, of course, the fourth part of the new patient visit and some skills is handling objections. Now, I hope if you have built rapport with the patient and you've experienced this great flow with good communication, that you might be handling objections earlier in the visit and being able to discuss that with the patient. What do we think? What do you think, or usually, is the number one objection people have? Okay, we always think the number one objection is money, but I don't think it is. People will find a way to pay for things that they really, really need, or they've felt a value for. So sometimes when a patient says no to oral appliance therapy, it's not really a no. There's other reasons. One big reason is that they don't understand or value their condition. Sometimes simply they're making their spouse feel better because the spouse has made them schedule a visit, but they themselves don't really want to move forward with care. They just don't understand or value their condition. It might be poor timing. Poor timing, maybe they have things going on in their life, like a change of job or a big trip that they have coming up. So it doesn't mean no, that they don't want care. It just means not right now. They may also have other pressing medical issues, like a surgery coming up or something that they feel is a little bigger right at the time, or other pressing life events. Perhaps they're caregiving of a family member that's having surgery. So it's just the right now that isn't the right time. I think a great skill for this is once you hear their objection, that you can meet their needs. It might be as simple as, John, hey, I know you're changing jobs. You've expressed you're not ready to get started today, but would it be all right if I circle back up with you in June and see if it's a good time to get started? And patients really appreciate that. Make sure that you're obviously, if you say that your admin team is keeping a list of months that they need to reach back out to the patient, and you'd be surprised how many patients are very open to that. Even if it happened to be a cost issue, maybe they've met their medical deductible, or just simply their finances have eased up in a way that they're able to proceed. So just because a patient says no, it's not a failure. It just means we have to follow up. I've had patients who either didn't qualify for an oral appliance or truly said no because of cost, but they've ended up referring numerous patients to my practice who have said easily yes to treatment. Think about that. You think you have one objection, a no, and they refer 5, 10 people who go ahead with treatment right away. So what excellent marketing that is. Following these good new patient skills, always circling back to the patient's why, and generally caring about them and following up. All right, so today I've given you some essential skills for 4 parts of this new patient visit: building rapport, reviewing findings, making it meaningful to them with reviewing the findings, presenting the plan, and not dropping the baton between you and your team there, and handling objections. Thank you so much. I hope I've given you some pearls. Here's my info on the screen, and thank you so much.
All righty. Thank you, everyone. Hang tight here. A couple more things to cover. And then if you want to put your questions, any remaining questions in the question and answer box, we'll get to those at the very end. Or raise your hand and I can unmute you and we can have an open discussion as well. So make sure you raise your hand or put those questions in there and we'll get to those in just a moment.
Trish, am I still on?
Yes, you are. Mm-hmm.
I realized something I wrote down as a little PS at the end. When it comes to presenting financials, I think that's a really key point that's made a difference. When you're presenting the total cost of treatment to the patient, in our practice, we present it as a comprehensive sleep apnea treatment plan. So we can fall in the trap of putting a total dollar amount and the piece of plastic, oral appliance therapy. But really, there's so much more that goes into it, and I think it creates a lot more value for the patient. when we let them know, or even on the page of paper that might present the financials, what it includes, that it includes the case initiation, it includes the planning, it includes the consultation, which is all part of what you just did. Then, of course, it does include the oral appliance therapy. It would include follow-up visits to get them calibrated, and then also MD communication, communicating with their physicians. So when you present it like that, I think it's a little more meaningful for a patient. So that's a little tip that I have there too.
Yeah, absolutely. That's a great tip. I know everyone likes to know the value of what they're spending, so I'm
Mm-hmm.
sure that's a helpful component. Absolutely. Alrighty. Well, a couple things here. If you wouldn't mind heading over to the next slide.
Yep.
Like I said, we'll still answer some questions here at the end, so feel free to put those in the question and answer box. I promised you all a promo code at the end. So you have a couple more days left until next Friday, the 7th, to receive 50% off your milled morning aligner. We love the milled morning aligners here. Just great for that double check, making sure there's no bite changes in the morning. You can add those to any case, like I said, for 50% off through next Friday, the 7th. So feel free to use that milled aligner 50 code at either checkout at DDX or on your RX in the notes section. And then I'll have you go to the next one for me, please. Thank you. Of course, if we can support your lab needs, we would love to do so, whether that's specifically with an appliance or just supporting you throughout your journey and answering any questions you may have. If you're not a true functional client, on the left-hand side, you can scan that QR code and that'll get you right to our new account form. And we can always schedule a call and kind of discuss how we can help you and what your needs are, of course, for your appliances and for your patients. We would love to have you join us for our next webinar. It is going to be March 7th, or excuse me, it's going to be March 26th with Dr. Brajesh Chadwani discussing tailoring your occlusal appliances for TMJ disorders. So we hope to see you all there. We're going to shift gears from sleep apnea to TMJ next month. So we always like to give, that wide variety. So go ahead and scan the QR code on the right. That'll take you to our education page on our website where you'll see that and a couple other ones we have scheduled coming up as well. We have some really exciting things coming up for 2025, so make sure that you stay up to date through our socials and through our emails because there's a lot of new and exciting things coming. So stay up to date there. You'll be seeing those. We'll keep you in the loop as well on anything new on our webinars. So I know a lot of you are going to ask about the recording that will be sent out usually early next week. We got to do a couple, we need a couple days to do some editing, and then we'll get that out to you as quickly as possible, so you can share it. If you want to rewatch it, or this would be a wonderful one to share with your team members. So you'll have the recording of that in the email that you registered for the webinar. So as always, if there's any topics you'd like us to discuss at a future date, feel free to drop those in the question and answer box too, and I can jot those down for a later webinar. All righty. Any remaining questions here? Any last questions? You can raise your hand. We can have an open discussion with Dr. Sceville. Anything about that new patient exam and making sure that you're building that rapport? Any questions on that process? Case acceptance, anything like that? Do you perform a new patient consult for free, or do you bill for it?
In my practice, we do free consultations. And I feel that that's a really good thing when I'm working with physicians, letting them know that I will absolutely do a consultation with a patient. Some patients that are referred do come kind of ready to go, so we schedule them a little differently. But if a patient is just interested, we schedule a free consultation with the main goal that we are simply discovering if they're a candidate. And that can be we can do all these skills very, very efficiently in the appointment, simply to find out if they're a candidate. And I love to be able to create time if they do want to move forward during that visit, that we have a team member that can help us move forward with the treatment. The same day scan.
Excellent. And I have heard too, just different philosophies on treatment where if they do charge, maybe it's a credit that goes towards their treatment. So it's
Yeah.
not really a charge if they move forward with treatment. I know that there's a few different, ways to
There's
do it.
there's many different ways, and it really depends on what you want your practice to look like in the end. Because we're in network with quite a few different medical insurances and things, oftentimes we'll be billing for the records when we actually do start start the case. But the actual consultation to meet us and discover if they're a candidate is we do that complimentary.
Great question. Anyone else have any other questions? All righty. Well, thank you so much, everyone, for joining us this evening. Dr. Sceville, it was so great to have you. I really
Thank
appreciate
you.
you spending the evening with us, too. We hope to see everyone again next month. And if you have any remaining questions, if you think of anything after the webinar, feel free to email that to me. I can always share that over with Dr. Sceville, and I'm sure she'd be happy to answer those later. So stay in touch with us. We're happy to kind of address any follow-up questions, and we hope you all have a wonderful evening. And thank you again for joining us this evening.
Thanks, Trish.
Thank you, Dr. Sceville. Have a good evening.
Bye-bye.